How does grief cause physical pain and inflammation? Have you ever wondered why grief can feel so heavy, not just emotionally but physically? The connection between grief and physical pain is more profound than many realize. When someone experiences grief, especially after losing a loved one, it triggers a complex response in the body. This response involves the brain, the immune system, and the body's stress response. When grief strikes, the emotional distress activates the body's stress systems. One key player in this process is the hypothalamic pituitary adrenal axis. This activation leads to the releases of stress hormones like cortisol and adrenaline. While these hormones can help in immediate stressful situations, prolonged exposure during grief can disrupt normal immune function. This disruption can lead to increased inflammation throughout the body. Inflammation is the body's natural response to injury or infection. It involves immune cells releasing signaling molecules known as cytokines. Research shows that individuals experiencing intense grief symptoms often have higher levels of pro-inflammatory cytokines. Examples include interleukin-6, tumor necrosis factor alpha, and interferon gamma. These molecules promote inflammation, which can manifest as physical symptoms. Common complaints include muscle aches, joint pain, headaches, and stiffness. Moreover, the loss of a close attachment figure, such as a spouse, can upset the body's physiological balance. This disruption can lead to further inflammation and physical pain. Grief-related stress can also suppress immune cells, making the body more vulnerable to illness and worsening existing conditions like arthritis. Understanding that grief affects both the mind and body is essential. It helps create a supportive space for those going through loss. Acknowledging that physical pain and inflammation are real and tied to emotional grief can encourage compassionate self-care. To manage these physical effects, consider gentle physical activity, adequate rest, and balanced nutrition. Seeking social or professional support can also be beneficial. These practical steps can help regulate stress hormones, reduce inflammation, and ease physical discomfort during the grief journey. By recognizing the connection between grief and physical pain, individuals can take proactive steps toward healing.